Now, let me clarify that psychotic, irrational behavior is not always due to hormone imbalances. Some of you who are feeling this way may indeed be crazy. But before getting hooked on drugs and allowing yourself to be labeled as insane, why not see if hormone imbalance can be ruled out? Let's take a moment to recap. Remember, DNA programs metabolism, and hormones control DNA. Understand that the tiniest, slightest hormonal shift causes profound changes in your body and the way you think. Sometimes this is good, as when your body responds to the sugar onslaught of a chocolate orgy, or when your mind reacts quickly to danger, as in the fight or flight response. Sometimes this is very bad, as we've seen in the examples and cases I've presented. Once I unlocked these secrets, I realized that many of the women that had come to me in my practice had been experiencing various forms of hormone imbalance. I repeatedly saw thyroid, pituitary, and adrenal gland weaknesses in these ladies when I performed an iridological examination. In addressing these issues through supplement protocols and dietary suggestions, I was adjusting their imbalance and giving them relief without even realizing how powerful the synergy of these three hormone-producing glands can be. It was only after experiencing my own meltdown that I put the pieces of the puzzle together. Currently, I use metabolic examinations and employ more comprehensive testing, so I can quickly pinpoint hormone imbalance when it exists. The thyroid, pituitary, and adrenal glands are the three major hormone-producing glands that control mood and metabolism. Many women who have underlying histories of depression, menstrual disorders, fatigue, joint inflammation, allergies, weight issues, or they just don't feel right even though conventional medical tests all come back as normal, have weaknesses in these glands. As they enter perimenopause, that can start as early as age 30, they all stand on the precipice of hormone hell. Often, their medical doctors' knee-jerk response to prescribe Synthroid and Prozac. Although these three glands, the thyroid, the pituitary, and the adrenal, all work together, I will focus on the adrenal glands and will be doing a little more biology as well as examining causes and some all too familiar effects. Here are some interesting facts. We are virtually swimming in a sea of estrogen. Babies are drinking hormone-laden milk. We eat dairy, poultry, and meat from animals overdosed with unnatural quantities of hormones. Girls are developing as young as age 8. Stress is at an all-time high, and it doesn't look like it's going to start to drop very soon. We take drugs for a fast fix, and I'm talking about over-the-counter medications as well as those dished out by medical doctors. We bathe ourselves in caffeine all day long. We drink contaminated water or no water at all. Some still smoke or are exposed to the smoke of others. Birth control pills, a powerful hormone cocktail, are used for years to resolve menstrual disorders and skin problems, purposes for which they are not intended. We jump at any fad that promises to rejuvenate our face or reduce our waistline. We have runaway obesity in this country, so it looks like some of those fads aren't really working. Cancer, colitis, asthma, ADD, ADHD, and autism are at epidemic levels and still rising. We women have to deal with the direct threat on ourselves, plus the nightmare of how these things affect our children, our partners, and the larger sphere of our families. It's time for a wake-up call. We must take back control over our bodies, our minds, and our spirits. This means that we must take responsibility for what happens to us and what is done to us by those health professionals from whom we take counsel. It's time to become wise women. Let's continue on our journey. It's time to understand the role of the sex hormones on our bodies and our lives. Estrogen, progesterone, and testosterone. Let's talk about estrogen first. Estrogen makes you feel sexy and womanly. Estrogen maintains the regular length of your menstrual cycles. Estrogen keeps your vagina and vaginal walls well lubricated and healthy, so sex is fun and not painful. This also maintains proper vaginal pH, so bladder infections are less likely to develop. Estrogen keeps your boobs nice and plump. Estrogen is necessary for normal brain function by controlling and maintaining optimal levels of essential mood-controlling chemicals, neurotransmitters, such as serotonin, dopamine, and GABA. Estrogen is responsible for your ability to remember words and names, and the ability to learn new things. Whether you enjoy needlepoint or need to remove a splinter from your child's finger, it is estrogen that helps you maintain fine motor skills. Estrogen contributes to the softness and thickness of your skin by increasing the number of blood vessels and water content in the skin and maintaining collagen levels. Estrogen stimulates nerve growth. Estrogen protects your heart and bones. It decreases the activity of the cells that break down bones and reduces total cholesterol by lowering LDL, the bad cholesterol, and increasing HDL, the good cholesterol. Last but not least, estrogen improves glucose metabolism by regulating insulin levels in the blood. I think we can all agree that estrogen is our friend. Let's take a look at progesterone. Progesterone decreases the risk of endometrial cancer. Progesterone can reduce uterine contractions, cramping, and pain. Working with estrogen, progesterone helps maintain a healthy libido. Again with estrogen, it helps maintain the health of your urinary and vaginal/endometrial tracts. And once more, with estrogen, progesterone increases bone density by maintaining a healthy supply of bone-building cells. Progesterone has a calming effect on the nervous system, thus helping control anxiety. It helps to maintain a normal appetite. It helps to keep your nice, full boobs. At normal levels, the key to much of our discussion, it may help to prevent breast cancer. Progesterone improves blood flow to the skin and can help to maintain normal blood pressure. Progesterone. We like that one too. On to testosterone. Think we're about to get into enemy territory? Perhaps not. Testosterone is the most important hormone for maintaining your sex life. Testosterone helps to maintain a healthy, positive mental attitude, confidence, and feelings of self-worth. It helps women form good interpersonal relationships. Testosterone helps prevent a decrease in skin collagen. It helps prevent skin from thinning and aging by maintaining balance in sebaceous gland activity, the glands that secrete oil onto your skin. Testosterone helps build tissue. In fact, it plays the greatest role in tissue building. It increases bone repair, stimulates the growth and division of bone-making cells, and improves mineral assimilation, all of which stave off the aging process. Testosterone and estrogen work together to maintain and rebuild the joint cartilage between bones. Testosterone dilates and relaxes coronary arteries and can lower the incidence of angina pain. So, that demon testosterone is on our side as well. Did you have any idea how much more than just sex is controlled by the sex hormones? Now that we know what they are and how essential they are to the well-being of our minds and bodies, the answer to the question you've all been waiting for. Is there really a fountain of youth? Yes, there is. And it's to be found within each and every one of us.